perioperative and peri-anesthesia nursing. It is associated with patient's surgical experience during the perioperative period. So in those things, we have the three phases. First, we have the preoperative phase. It is where the patient is transferred to the operating room. So, of course, the nurses will be preparing for yung sasakyan niya and the things that are going to use, equipments or something that is needed to patient. So, next is the second is the intraoperative phase. So, this intraoperative phase is when the patient is transferred to the OR table to when he or she admitted to the post-anesthesia care unit. So, pagkalabas niya galing preoperative intervention or preoperative phases procedure. So, pupunta siya sa other table ng para sa peri-anesthesia para sa post-anesthesia care unit. So, doon malalaman kung anong klaseng anesthesia ang kailangan gamitin sa kanya. Then, next is the third phases is what we call post-operative phase. So, pagkalabas niya pagkatapos niyang mag-undergo sa intraoperative phase, doon siya sa post-operative phase. So, in that case, it begins with the admission of the patient to the PACU and ends after a follow-up evaluation in the clinical setting or home. So, doon na mangyayari ang operation or uumpisahan ang surgical for the patient. So, in short, from the preoperative phase, papasok siya sa isang room na or sa OR table para for some interviews or things that are needed for or what kind of operation na gagawin sa kanya. Then after that, lalabas siya, papasok na naman sa intraoperative phase. So doon maghahappen na pag-uusapan kung or i-find out ng physician kung anong klaseng anesthesia ang gagamitin sa kanya. The next is, lalabas na naman siya papunta sa post-operative phase. So doon, sa last part ng phases na yon is doon na mag-happen ang operation or the beginning of surgical experience for the patient. So the physician would be or the doctor will be handling that. So either be the doctor together with the physician and the nurses that were going to assist with them. So in addition, ang assessment na mangyayari sa preoperative phase is it involves family interview and the initial assessment for the surgeon. Then it verifies also the completion of the equipments of the patient. So pagdating naman sa intraoperative phase, it undergoes with the maintenance of the safety ng patient. Then yung human resources or patient's resources, aseptic or being aseptic na controlled environment para sa pasyente. The next is we have also to complete documentation. So pagdating naman sa post-operative phase, yung assessment naman na gagawin nila is they will going to maintain the patient's airway and check for the vital signs before starting the operation.
So for the learning objective for this topic is describe a comprehensive preoperative assessment to identify surgical risk factors. So assessment of health factors that affects a patient preoperatively. So then these are the risk factor for the surgical complications. So firstly is the hypovolemia. So the hypovolemia, this is a shock is life-threatening condition that result when you lose more than 20% or 1/5 of your body's blood or fluid. Then, this the severe fluid loss makes it impossible for the heart to pump and sufficient amount of the blood to your bodies. And the next one is the dehydration or the electrolyte imbalance. So dehydration is occur when you use or lose more fluid than you take in. Then this is the dehydration is the excessive loss of the water from the body tissues, often accompanied by an imbalance of the sodium, potassium chlorides, and the other electrolytes. Then the next one is the nutritional deficits. So nutritional deficiency occurs when the body is not getting enough nutrients such as vitamins and minerals. So there are a number of conditions that are caused by this nutritional deficiency, such as anemia. So the next one is the infections and sepsis. So the infections and sepsis. So sepsis is when your body has an unusual severe response to the infections, to an infections. So sepsis is a potential life-threatening condition that occurs when the body's response to an infections. So for the next one is the toxic conditions. So toxic conditions. So for the toxic conditions, so this is the physiological state produced by the poison or other the toxic substance. So for the toxic, the toxic effect are basically response to a xenobiotic substances and the express as triggering or the additional accelerating adverse effects toward the abnormal conditions. So the next one is the pulmonary disease, which is the type of disease that affect the lungs and other parts of the respiratory system. So pulmonary disease may be caused by infection by smoking tobacco or by breathing in secondhand smoke. So tobacco smoke, radon, and asbestos or other form of air pollutions. So for the next risk factors for the surgical complication is the obstructive disease. So the obstructive disease this is the type of the people with the obstructive lung disease have shortness of breath due to difficulty exhaling all the air from the lungs because of the damage to the lungs or narrowing of the airways, so inside the lungs. And exhaled air comes out from the slowly than normal. So for the next is the respiratory infections. So this is the acute respiratory infection is an infection that may interfere with normal breathing. So it can affect just your upper respiratory system, which starts at your sinuses and ends your vocal. So for the next one is the urinary tract infections. So the urinary tract infections, so which is UTI, is an infection in any part of your urinary system. So the UTIs are common infected that happens when bacteria often from the skin or rectum enter the urethra. So and the next one for the surgical risk factor for surgical complication is the obstruction. So for the obstruction, so an act of this, so this obstruction, this is an act of blocking or hindering. So it is caused by the intestinal obstruction, may include the fibrous bands of tissues, which is the adhesions in the abdomen that form after the surgery. So this is the hernias, colon cancer. And for the last one, for the risk factor for the surgical complication is the cardiovascular disease. So the cardiovascular disease, or CVD, is a general term of the conditions affecting the part of blood or blood vessels, and it's usually associated with the build-up of the fatty deposits inside the arteries or the atherosclerosis and the increased risk of blood clots.
So, this is the learning objective. So, first is cardiovascular system status. The goal in preparing any patient for surgery is to ensure a well-functioning cardiovascular. So, cardiovascular is ito ang goal ng isang nurse para sa patient undergoing surgery ay siguraduhin na may well-functioning yung cardiovascular. Tsaka pwede siya ma-postpone yung surgery pag may hypertension, yung may mataas yung blood pressure ng isang pasyente. So, hepatic and renal function. The purpose of preoperative liver and urinary system functions to ensure that drugs, anesthetic, bodily waste, and toxin are properly digested and eliminated from the body. So, dito is isa sa mga importanteng function ng ating katawan dahil tinutulungan nito na mag-waste, tinutulungan nito ng gamot na mag-proper digest siya ng katawan at dini sa mga toxics dahil or mga wastes na hindi na kailangan i-absorb ng ating katawan. May mga other conditions such as acute nephritis, acute renal failure, and oliguria and anuria na hindi inirekomenda. Ang surgery, liver function test may be performed upang ma-assess ang katawan at magapan kung may sakit na makita. So, immune function, an important function of the preoperative assessment is to determine the presence of allergy. So, dito is isa sa mga dapat na-assess ng mga nurses is kung may allergies ang isang pasyente sa gamot, pagkain, or antibiotic iba pa, because there are some who are allergies to certain antibiotics. That's why negative sensitivity test is also important because before administering the drugs. And immunocompromised patients are susceptible to bacteria. Kaya we should know the type of care na ibinigay sa mga immunocompromised patients. So, previous medication use. Some patients are taking aspirin as their daily drugs maintenance. Aspirin inhibits platelet aggregations, kaya we advise patient to stop taking the drug 7 to 10 days prior surgery to avoid bleeding during surgery. So, nutritional and fluid status. Important a patient in a good nutritional and fluid status before surgery because this play a key role in the patient recovery once a patient have a good nutritional and fluid status. The better para mabilis mag-heal in health niya after surgery. Then, alcohol and drug use can also cause complication during and after surgery. This abuse is malnutrition na pwede magpatagal ng healing process ng surgery patients. This can be also a complication for postoperative infection. So, patients who are obese. Obesity increases the risk and severity of complications associated with surgery. During surgery, fatty tissue are especially susceptible to infection. Patient with disabilities. Special consideration for patients with mental or physical disabilities include the need for appropriate assistive device, modification in preparative teaching, and additional assistance with and attention to positioning or transfer.
For the learning objectives of number 4 in the preoperative report or presentations, we need to identify the legal and ethical considerations related to informed consent. So, preoperative informed consent requires that the procedures are properly explained to the patient, understands the procedure and the risk, and agrees to undergo them voluntarily. One reason for taking informed consent is that it provides assurance that patients and others are neither deceived nor coerced. Informed consent is the process by which a patient learns about and understands the purpose of benefits and potential risks of a medical or surgical interventions and then agrees to receive the treatment. It is a legally required process before performing any medical or surgical procedure. If adult patients are mentally able to make their own decisions, medical care cannot begin unless they give informed consent. The informed consent process makes sure that your health care provider has given you information about your condition along with testing and treatment options before you decide what to do. A minor, someone who is years and younger, is generally considered not competent to make a decisions about the informed consent. As a result, it is the minor's parents who provide the informed consent for treatment. Obtaining patients' informed consent is the physician's responsibility. But the process is more than just a signature on a page. Surgery center staff are witnesses who confirm the informed consent from has been signed. The entire informed consent process involves giving a subject adequate information concerning the study, providing adequate opportunity for the subject to consider all options, responding to the subject's questions, ensuring that the subject has comprehend this information, obtaining the subject's voluntarily agreement. There are times when the usual informed consent rules do not apply. This varies from state to state and may include, in an emergency, if a patient is unconscious and in danger of death or other serious outcomes, if medical care is not given right away, informed consent may not be required before treatment. As nurses, we deal with informed consent a lot. On admission to a hospital or clinic, or before a procedure or surgery. Nurses typically are assigned the task of obtaining and witnessing written consent for healthcare treatment. The goal of informed consent is to assure patient autonomy. Informed consent is meant to honor your right to decide what's done with your body. Rules and the law pertaining to this topic have changed over the years, but one thing hasn't. Failure to obtain informed consent is a crime. Medical malpractice, specifically, and the doctor can be charged with negligence and battery. Valid informed consent for research must include three major elements: disclosure of information, competency of the patient or surrogate to make a decision, voluntary nature of the decision. U.S. federal regulations require a full detailed explanation of the study and its potential risks. 4 core criteria must be met. The patient giving consent must have capacity. The consent must freely given. The consent must be sufficiently specific to the procedure or treatment proposed. The consent must be informed. Ambulatory typically means the ability to walk, but in the context of surgery, it refers to patients who are able to leave the hospital the same day as the surgery without being admitted to the hospital. Inpatient and outpatient, surgeries can be both performed in the hospital. The difference between the two involves where the patient stays at night following the surgery. Outpatient surgery, also called same day or ambulatory surgery, occurs when the patient is expected to go home the same day as the surgery. Outpatient surgery is when you have a surgical procedure done and then later that same day you go home. Outpatient surgery can also be called same-day surgery or ambulatory surgery. Inpatient surgery, on the other hand, is when you have surgery and are required to spend at least one night in the hospital.
Objective learning number 5. Describe preoperative nursing measures that decrease the risk for infection and other postoperative complications. Today, I'm going to represent my topic, psychosocial factors. So, under that, preoperative teaching, when and what to teach, nutritional and fluid status, preparing the bowel, preparing the skin, psychosocial preoperative intervention, reducing preoperative anxiety, maintaining patient safety, cognitive coping strategies. So, psychosocial factors describe individual in related to the environment and how this affect to their physical and mental, like stress, hostility, depression, and hopelessness. So, preoperative teaching. It should start in physician office or at the time of path until arrive in the patients to the OR. So, when and what to teach. So, when ideal timing for operative teaching is not on the day of surgery but during the pre-admission visit and the diagnostic tests are performed. So, what to teach? Include instruction in breathing and leg exercise used to prevent the post-operative complications such as pneumonia, deep vein thrombosis. So, nutritional and fluid status. So, under nutritional status, that identify factors are obesity, undernutrition, weight loss, malnutrition. So, we took first the obesity. Obesity is a complex disease involving an excessive amount of body fat. So, under nutrition, insufficient take of energy and nutrition to meet an individual's needs to maintain good health. So, weight loss is a decrease of body weight resulting from either voluntary diet exercise or involuntary circumstances. So, malnutrition, lack of proper nutrition caused by not having enough to eat, not eating enough of the right things, or being unable to use the food that one does eat. Or then, fluid status. So, under that, dehydration and hypovolemia. So, dehydration, a harmful reduction in the amount of water in the body. So, hypovolemia, abnormal decrease in the volume of blood plasma. So, preparing the bowel. In preparing the bowel, cleansing enema or laxative may be prescribed in the evening of surgery and may be repeated in the morning in surgery. Then, preparing the skin. So, how to preparing the skin? Cleansing and disinfection. So, use soap containing a detergent germicide to cleanse the skin. So, preoperative social intervention. This intervention may be include cognitive, behavioral therapy, motivational, interviewing the chronic disease. Then, maintaining patient safety. So, use monitoring technology like bed alarms. Make sure patients understanding the treatment. So, reducing preoperative anxiety. So, the method use effective communication. Music therapy is easy to administer, and then personal visit. So the last topic is the cognitive coping strategies. So under that, I majorly the patient concentrate on a pleasant experience or risk for sin. Then distraction, the patient thinks of an enjoyable song or poem. Then optimistic self-recitation, the patient recite optimistic thought like I know all will go well.
Objective learning. Number 6, describe the immediate preoperative preparation of the patient. My report is about preoperative and pre-anesthesia nursing. There are three phases of preoperative and pre-anesthesia. First is preoperative phase, begins with the patient to proceed with the surgical intervention, is made, ends with the transfer of the patient into the OR table. Number 2, intraoperative phase, begins with the patient is transferred into the OR table and ends with admission to the PECU. Postoperative phase begins with the admission of the patient to the PECU and ends with a follow-up evaluation in the clinical setting or home. Next is maintaining the preoperative records. Example of the maintaining the preoperative records. The nurse, you should complete the preoperative checklist. So this is the example of preoperative checklist. Then, next is the nurse also complete the verification form and preoperative and other provide verification. So, this is the example of verification form. Patient name, date, height, weight, identification card, present, and etc. Next is attending to family needs. So, sa attending to family needs, karamihan sa mga hospital and ambulatory surgery centers, meron silang waiting room kung saan pwede maghintay ang mga family member ng patient habang ang patient is undergoing surgery. Doon sa loob ng waiting room, we have a comfortable chair, television, telephone, and facility for light refreshment. Pagkatapos ng surgery, the surgeon, kakausapin niya ang family ng patient sa labas ng waiting room. Pag-uusapan nila kung ano ang outcome. Then, pagkatapos ng surgery, you should inform the patient it may have an outcome equipment or device. Example, IV lines and wheeling, urinary catheter, nasogastric tube, oxygen lines, monitoring equipment, blood transfusion lines in place when he or she return to the surgery. Next is administering pre-anesthetic medication. So, if a pre-anesthetic medication is administered, the patient is kept in bed with side rails and raised, because the medication can cause lightheadedness or drowsiness. During this time, the nurse observes the patient for any outwards reaction to the medication. Pagkatapos ng surgery or OR schedule are changed, it becomes impossible to to request that the medication be given a specific time. So this situation, the preoperative medication is prescribed on call to OR. Like, the nurse can have the medication and ready to administer as soon as call is received from the OR staff.
My topic is about gerontologic consideration. Preoperative pain assessment and teaching are important in the elderly patient. Elderly people frequently do not report symptoms, perhaps because they feel a serious illness may be diagnosed or because they accept such simple symptoms as part of the aging process. Research indicates that key predictors or perioperative complications in the elderly are the patient preoperative condition and level of functioning by John and Siebel 2004. Gerontological consideration ang preoperative pain assessment at ang pagtuturo nito ay napaka-importante sa mga matatandang patient. Karamihan daw sa mga matatanda hindi nagre-report ng mga symptoms na feel nila kasi it's either takot sila o kaya iisipin nila dahil sa tanda na rin kung bakit sila magkakasakit. So, bilang isang nurse, dapat alert sila sa mga clues which underline problems na nararamdaman ng patient. So, ang key daw para malalaman ang mga maaaring komplikasyon ng matatanda condition nila bago silang operation. Relief for anxiety. Simple activities can help soothe the mental and physical signs of anxiety. These techniques. So, relief for anxiety evidence when the patient. Pero dapat pag-uusapan o mag-uusap kayo ng anesthesiologist or nurse. Anesthetist regarding anesthesia na gagamitin o gagawin. Before operation, dapat alam natin o naintindihan natin before anesthetic medication. Pati yung general anesthesia, pag-uusapan nyo ng nurse, doctor, and physician about the time management. Before the operation, kung kinakailangan ba pag-uusapan nyo yung financial concern ng operation, pati nga social workers. Kung kailangan natin mga financial yan. And kung kinakailangan mag-visit ka ng spiritual advisory or mag-relax ka na pagkatapos mong bisitahin ng mga health team. Decrease feel. Practice stress reduction techniques such as mindfulness meditation or aerobic exercise. Shift your focus to the positive emotion in daily life. Ito, decrease skill, pag-uusapan mo yung takot mo, pati ng healthcare professional o kaya spiritual advisors o pwede din both para ma-less ang takot mo. Intindihin mo na maaari may pagbabago sa iyong katawan o pangangatawan. Yun ang tinatawag ng decreased feel. Understanding of the surgical intervention. A surgical intervention can be thought of as an addition or a modification to the current vascular structure, like the addition of the stent or the clipping of an aneurysm. O understanding of the surgical intervention, pag-participate ka sa preparation mo bago may surgery, or demo mo na kaya describe sa patient ang exercise ng dapat niyang undertake. O mag-review ka ng information about opera na natapos na. O tanggapin mo ang pre-anesthesia medication kung nag-prescribe. Manatili sa bed once pre-medicated. Mag-relax during transportation sa OR o kaya units. I-discuss mo yung especially ang paggamit ng side rails o pag-usapan niya kung ano ang possible na nangyari pagkatapos ng surgery.